Presiding officer, a quarter of families are now living in poverty in Scotland. Urgent action is required across a range of areas to protect families from the immediate impact of the cost of living crisis and austerity. Parents need to have consistent and sufficient income to plan ahead and make decisions for their children. Parental employability funds exist to assist in the lifting people out of poverty. These have been stripped of more than 20 million in a year by the SNP government. We welcome the news that the Scottish Government has finally listened to the Scottish Labour and provided resources to wipe school meals debt. However, this policy is limited to a year, and without sustained investment, this debt will begin to build up again almost immediately. Adverse childhood experiences have been found to have a lifelong impact on mental health. One of these is a childhood spent below the poverty line. According to Public Health Scotland, children born into poverty are more likely to experience mental health problems. Prevention for adverse childhood experiences such as poverty are essential for fostering long-term mental well-being for young people. Public Health Scotland advised that majority of the mental health problem will develop before the age of 24, with 50% of mental health difficulties established by the age of 14. The SNP is set to miss its own statutory child poverty target, with 23% of children in relative poverty in 2021-22. Children born into impoverished areas will eventually face significant hurdles in their life. The longer children live below the poverty line, the bigger impact it has on their overall health, development and well-being. If the Scottish Government failed to meet its own 2030 child poverty targets, it faces an even bigger strain on the NHS, mental health services and social security as a result. I want to progress. The Scottish Child Payment is a welcome investment in lifting children out of the poverty, but there needs to be a more targeted approach to addressing the consequences of a childhood below the poverty line. The Glasgow Centre for Population Health have an exhibit this week in the Parliament, and many in the Chamber will have already visited their stand. Their centre's recent report outlines the cost of living crisis and austerity are affecting mortality rates across Scotland. In 2019, it was reported that a boy born in Muir House had a life expectancy at the time of 13 years, less than a boy born in the neighbouring Cramond. This is still the reality for many children who grow up in poverty. Across the nation, healthy life expectancy is decreasing, but it is decidedly lower for those who are from the most deprived areas across Scotland. I want to progress. The report also emphasised trends of increasing death rates among poorer communities across the country, which are made worse by the pandemic and cost of living crisis. These inequalities can often be linked back to our childhood below the poverty line. Yet, we are still seeing budget for tackling child poverty and social justice reduced. Budget were down 3 million this year alone, and 68.8 million compared for 2 years ago. Finally, presiding officer, the Scottish Government must make its 2030 child poverty targets, but also address other inequalities that people in Scotland are facing. Social security costs are spiraling. We are seeing the multi-million pounds increase to running the cost to support the delivery of devolved benefits. Yet, we are still seeing alarmingly high waiting times for child disability payments, and there is no great improvement when looking at waiting times for adult disability payment. Around half of all people living in poverty are living in a household with at least one disabled member. The Scottish Government must do so much more to patch up the broken system. Thank you.